My name is Carmela McGee. I'm going to be demonstrating today IV solution with IV piggyback for my instructors at Excelsior University. I have my supplies set up here with my gloves, my alcohol wipes, my medications, my drip tubing, my hand sanitizer, my MAR, my patient with her IV tubing, and her identification bracelet. All right, let's go ahead and begin. Wash my hands. So in the med room, I have pulled up my patient Renee Adams, 5/25/1978. The first medication that she's going to get is her sodium chloride, 500 milliliters, to be administered continuously over 4 hours via gravity drip using 15 drop per milliliter tubing. So here I have pulled her sodium chloride, 500 milliliters, and this is her 15 drops per milliliter tubing. Also, while I have this in my hand, I'll go ahead and check the expiration. It's 4/27. It's not leaking, and there's no particles in it. I went ahead and did the math for her sodium chloride over 4 hours with the 15 drop tubing. That means she'll get 31 drops per minute. The next medication, which will be the piggyback medication, is the ceftriaxone sodium, 1 gram. And I have that ceftriaxone, 1 gram, in normal saline to be administered over 30 minutes. And it's in 50 milliliters of normal saline over 30 minutes using the 15 drop per milliliter tubing. Again, check the expiration date. It is also 4/2027, not leaking, no particles. And so we have that medication ready to go for the patient. So let's begin. Wash my hands again. I'm in the med room, so I'm gonna go ahead and prep the medications before I go into the patient's room. So I have the IV set here. Let's go ahead and open that up. And I have her medication. So before I spike the bag one more time, I'm gonna go ahead and check that I have the correct patient, Renee Adams, 5/25/78. She has ordered sodium chloride, 500 milliliters to be administered with the 15 drops per milliliter tubing. So let's go ahead and spike the tube. Invert it. Fill up my chamber halfway. Good. Hang it up on my IV pole over here. And let's flush the line. So I'm going to go ahead and get all the bubbles out, flush this into my trash receptacle, make sure all the bubbles are out. Woo, there they go. All right, good. All the bubbles are out. Okay. All right, the next medication I'm going to go ahead and prepare in the med room before I go in will be her piggyback. This is a ceftriaxone, 1 gram. Ceftriaxone, 1 gram. Piggyback to be given in 50 milliliters of normal saline over 30 minutes. Normal saline, again, no particles, not leaking. Expiration is 4/27. Let's go ahead and spike that bag. I'm going to open my tubing. I'm going to spike the bag. Invert it. Go ahead and fill up. Let me make sure this is locked. Practiced so many times. All right, we're gonna, chamber is half full. I'm gonna go ahead and hang this here just for now. I'll replace it later in the right position. Right now I'm just gonna flush the line, being very careful when I flush the line to not waste any of the medication. So let's go ahead and flush the line. Get all the bubbles out. And there we go. All right, so this is the piggyback secondary. Okay, now I'm going to go into my patient room with my medications and my MAR. Hello, Miss Renee. My name is Carmela. I'm going to be your nurse today. Let me provide some privacy. I'm going to pull the curtain. Your doctor wants you to have some medications today, so let me just go ahead and wash my hands. And let's put some gloves on. I'm going to verify your name, date of birth. Can you go ahead and state for me your name and date of birth so I can check your band with my MAR?
Renee Adams, 22578.
Are you sure on
I
your
know,
birthday?
52578.
Okay, good deal. It's fine. Your band is 52578. Renee Adams. That's the patient that I have here. Okay, good. I'm gonna go ahead and assess your IV. Are you having any pain today, Miss Renee?
No, ma'am.
Okay. No redness, no tenderness, no signs of infiltration.
No.
Okay. Okay. Let me go ahead and take my gloves off. All right. So the first medication your doctor wants you to have is your sodium chloride 500 milliliters. So I have here your sodium chloride 500 milliliters, 427, not leaking, no particles, and it is sodium chloride 500 milliliters over 4 hours. Okay, so we're going to go ahead and connect that to you, Miss Renee. But first, I want to scrub your hub for 15 seconds. So let me do that. I'm going to scrub your hub for 15 seconds. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 8, 10, 12, 13, 14, 15. Okay? And let's go ahead and connect your sodium chloride. Okay, good deal. Make sure that your IV is in there good so it doesn't come off. Okay, now before I set that drip rate, I'm going to go ahead and unclamp the line. And let me check your drip rate and I'll tell you when we're going to begin. Let me just put my watch on the other hand, it makes it easier to see. Okay, I'm gonna set your drip rate at 31 drops per minute. And I'll tell you when we're going to begin. Make sure it's unclamped. It is. Okay. And begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Perfect. Got it on the first try. All right, so we're gonna let that run, Miss Renee, at 31 drops a minute. And I'm going to wash my hands. And I'm gonna go ahead and document that that is done. Okay, now I'm back, Miss Renee. Your doctor wants you to have a piggyback IV solution. So we are going to hang your primary lower and then your secondary higher so we can get a good drip rate on that. And so your doctor wants you to have, let me double check, the medication is ceftriaxone, 1 gram, ceftriaxone 1 gram, and 50 milliliters of normal saline. 50 milliliters normal saline. So that's going to equal to 25 drops per minute. Okay, so before we do that, let's go ahead and stop this line. Okay, and I'm going to scrub your hub for 15 seconds at the Y The antibiotic, by the way, is for a UTI. That's what your doctor's treating you for. Okay. And let's go ahead and connect. Excellent. And we're going to open up the line on the ceftriaxone, and we're going to use the primary line to try to titrate to do your drip rate for your infusion. How are you doing, Miss? Let me just double check that, since that other one's been running for a while. Before we start your drip rate, let me wash my hands. Let me just double check your site. Are you having any pain at all, Miss Renee?
No, ma'am.
Okay. Since the other one's been running for a little while, let me just make sure there's no infiltration and make sure there's nothing going on with your IV. So I'm gonna touch you here. You said no pain, so there's no redness, no signs of infiltration.
No, ma'am.
Okay. All right, so now we can go ahead and start. I'm gonna pretend I'm throwing these away, but I'm gonna reuse these in a few minutes, but we're gonna use real clean gloves in a minute. So let me set that drip rate at 25 drips per minute on your antibiotic. Okay, gonna wash my hands. We threw those gloves away. Okay, now we can go ahead and do your titrate with your primary line. Okay, let me get this started and I'll tell you when we're gonna start. Down here where I can see. And this one is 25 drops. And we're going to begin. Get it just about right before I start to count. Start to see. Okay. Okay, that looks like it's about the right rate. So let's start counting now. Oh, no, Siri, I'm not talking to you. Okay. Don't know why Siri kicked on. I'm going to start to count now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Perfect. All right. Got that one on the first try. Okay, good. How you feeling, Miss Renee?
I'm okay.
Okay. So we have your piggyback running here. Let me go ahead and wash my hands. Put some gloves on. I'm going to assess your site again for the third time just to make sure we're not having any infiltration or anything going on now that you have another medication running through your line. So are you having any pain at all, Miss Renee?
No.
Okay. No signs of redness or irritation, no coolness, no swollen or edema areas?
No.
Okay, good deal. All right, Miss Renee, let me wash my hands. And I'm going to document, and we are done.